السلام عليكم ورحمة الله وبركاته. My name is سلوى طوبار. I'm a professor of psychiatry, Mansoura University. Today, inshallah, we will talk about two of the child psychiatric disorders. Let's say disorders that have an onset in childhood period. ADHD and Autism. Inshallah, we will start with ADHD. At first, we would like to see how it looks. So this is how Samantha presents. Actually, it may be confused with a normal, slightly hyperactive child, or maybe with other diagnoses. But ADHD per se, prevalence is about 1 in 10, or about 11 in per 100%. So it is 11%. Okay. So let's, if we say that we have 2 classrooms, we have in each classroom like 5 children with ADHD. How to diagnose ADHD? Actually, all these criteria must be met, again, to exclude other causes of this hyperactivity. So the first criteria is the symptom criteria. It needs 6 or more symptoms of inattention and or hyperactivity. So you may have 6 symptoms of inattention or 6 symptoms of hyperactivity or 6 of both to be fulfilling the first criteria. For the second criteria, it necessitates those symptoms or most of these symptoms have an onset before 12 years of old. This criteria actually is meant to exclude mood disorder, bipolar disorder, which have many common symptoms with ADHD. So the DSM-5 needs the onset to be before 12 years of old. The third criteria necessitates those symptoms to be present in at least 2 different settings. This is to differentiate biases from the side of the mother or the reporter in reporting the symptoms. So maybe we have an anxious mother who tells us that her child is overactive, while actually at school the child is normal, is calm, the teacher has no complaints, so it does not fulfill these criteria and the child will not be diagnosed as ADHD. The fourth criteria is the usual functioning criteria in all DSM-5 categories that necessitates that these symptoms in this duration, which is 6 months, with onset before 12 years and in 2 different settings, are impairing the function of the patient. The fifth criteria is also the constant criteria in DSM-5 of exclusion of other psychiatric disorders. So for diagnosing ADHD, we know we need all the criteria to be present. That is at least 6 symptoms for with onset before 12 years in 2 different settings, not better explained by other psychiatric disorder, impairing the function, and of at least 6-month duration. What are these symptoms? These symptoms are classified into 2 main groups: the symptoms of inattention and the symptoms of hyperactivity. Regarding the symptom of inattention, it is at first the patient makes careless mistakes or lacks attention to details. The second, difficulty sustaining attention. So the patient is more or less distractible, easy distractible. He pays attention easily but shifts it after a short time. Exhibits poor listening skills because while others are talking, he is not paying attention at the first place or pay attention for a very short period, so he seems like not listening. Fails to follow through on tasks. So while performing tasks, this inattention will impair his ability to keep following the task. So he will exhibit poor organization. He cannot prioritize. He cannot keep and follow through the task. So he will avoid or dislike tasks requiring such mental efforts. He seems forgetful, so he loses things. For example, if a child is coming back from school, the mother discovers that he has lost his coat, his pencils or whatever. He's easily distractible, as we said before, and the forgetfulness. The previous were the symptoms of inattention. Here are the symptoms of hyperactivity. If the patient can keep seated, he fidgets, like he always moves in his chair, he fidgets. Or he cannot stay seated and leaves seat while it is required, for example in classroom, so he cannot be maintained on his seat for a while compared to the other normal children. Or not even leaves his seats, but he runs or climbs much in, again, inappropriate situations. Or even if he is in a playroom or something, he cannot have leisure time quietly. So he has difficulty engaging in quiet, leisurely activities. He is always on the go, as we said in case of, as we seen in case of Samantha. He talks excessively. He blurts out answers, so he may begin to answer even before the question has ended. Has difficulty waiting their turn, so even during a game or something, he cannot wait his turn. Okay, and this is the same during conversation, so he intrudes on others or interrupts others. Actually, the last three criteria are more because of the impulsivity. So we can say, we can see that those child can present differently according to the predominant symptoms. What is the predominant symptom? Are the symptoms exceeding the cutoff, that is 6 symptoms, are predominantly the inattention symptoms? So in this case, the child will be diagnosed as ADHD, predominantly inattentive type. Or are the symptoms that exceeds the cutoff is the hyperactive, so the child here is an hyperactive impulsive subtype. Or sometimes the symptoms of both categories of symptoms are exceeding the cutoff, that is 6 or more of the symptoms, so in such case he will be diagnosed as the combined subtype. We should know something about the etiology, management and prognosis of ADHD, but not now. What I should or I would like to say that ADHD has a positive side. Those children or individuals are artistic, daring, humorous, and dynamic. So that among the celebrities we can see people who are diagnosed as ADHD according to Google. That is like Justin Timberlake and Channing Tatum. The second disorder we will discuss today is autism. We have come across many autistic personalities in the movies. This is the Korean Good Doctor. This is the Indian Doom 3. This is the Indian My Name is Khan. And this is the American Rain Man. It thinks like this always? No, we actually speak of an autism spectrum disorders. In the DSM-4TR, this is the diagnostic system, the American diagnostic system, the fourth revision, text revised. It was called pervasive developmental disorder and included those disorders, that is autistic disorder, Asperger, Rett's, and childhood disintegrative disorder, plus the pervasive developmental disorder not otherwise specified. In DSM-5, the currently available version, autistic disorder, Asperger, and pervasive developmental disorder, NOS, are put under autism spectrum disorders. Put in mind also is that 70% of autism spectrum disorder have IQ less than 70. Less than 70 is the degrees of mental retardation. So that's to say 30%, that's about a third of the cases, are not having mental retardation. So that we have a spectrum of the disorder from the severe cases with severe mental retardation and severe autistic features to the high functioning cases, the Asperger syndrome cases like those we have seen in the movies. The prevalence of autism spectrum disorder is actually rising. In 1985, it was 1 in 2,500. In 2000, it was 1 in 150. And in 2010, it was 1 in 68. Actually, this rise of the prevalence is attributed to many factors, among which is that we are talking about spectrum and not only the severe cases, and also the rising awareness. In a child, it is how autism spectrum disorder looks like.
Look at mommy.
He is avoiding eye contact and ignoring mommy, and also keep repeating this way of playing with the ball. This is a normal child. This is the autistic one. A normal child is having eye contact with the mother. While the autistic one is not. The normal child points with his toys to the mother, contrary to the autistic child. The autistic child, the only interest is this vehicle, this wheel. Is interesting only in the spinning Hello. If a normal child is given a car toy, he will move it as if it is a real car. This is an autistic child. When we give him a car toy, he is just interested in the wheels, the spinning wheels. there is no pretend play, so he's not pretending that it is a car and moving it. No, he's having an abnormal interest, abnormal restricted interest. So, the DSM-5 diagnostic criteria for autism spectrum disorders requires all these 5 items. At first, deficits in social communication, the restricted repetitive pattern of behavior, interest, or activities. Symptoms must be present early in developmental period, as we said in ADHD, but here it is much earlier. Symptoms cause clinically significant impairment. This is the functioning criteria, and also the exclusion criteria, particularly that the symptoms are not due to intellectual disability. Actually, there is much overlap between autism and intellectual disability. As we said before, that like 70% of autistic people are having some degree of intellectual disability. So, in case of comorbidity, it means that the deficits in communication are not attributable to intellectual disability, meaning that it is below even the mental age of the patient. So, to start with, persistent deficits in social communication. It was divided into problems with reciprocity, non-verbal communication, which are reflected in relationships. Reciprocity means that we have abnormal social approach, failure of normal back and forth conversation, reduced sharing of interest, emotions, or affect, as we said in case of Ash, and or complete failure to initiate or respond to social interactions. The non-verbal communication may be poorly integrated with the verbal, so it's not matching the verbal, or there may be abnormalities in eye contact or body language, or deficits in understanding and use of gesture, or total lack of non-verbal communication. This, of course, will be reflected on relationships when there is difficulties on starting, difficulties on sharing, or complete absence of interest in relationships. The second item required by the DSM-5 is the restricted repetitive pattern of behavior, interest, or activities. So, I think it is more obvious here where we have all of these areas of functioning restricted or repetitive. So, regarding the behavior or the motor movements, there is the stereotyped or repetitive. Okay. Also, it may affect on may be present in speech, where the patient repeats some words or some phrases, sometimes inappropriately. Okay, insistence on the sameness, so the patient does not want to change his routine. Highly restricted interest, that abnormal in intensity or focus, as we have seen in the case of Ash, where he is just interested in the spinning wheels. Okay, or those people also have abnormal sensory input. It may be hyper or hypoactivity, so that sometimes we see them closing their ears. They are perceiving things too loud, up to painful, or on the contrary, they may perceive things as lower than the usual, so that we may see them tighten their belt or something very much. So again, we have restricted repetitive behavior, interest, and activities. The C criteria is that it is must be present early. The D criteria is the impaired function, and the exclusion criteria, particularly from intellectual disability. And thank you very much.